Just to check with you before we continue, you're a 22-year-old male with localized toothache pain in the lower right jaw area. It began on June 3rd. The symptoms, you described the intensity rated as 6 out of 10. The symptoms worsen with the consumption of cold foods and drinks and improve with Advil. You also mentioned the presence of nausea or vomiting. Which one is it? Then they'll tell me. You tried Advil as treatment, which was partially effective. And you're a smoker, your chronic conditions include smoking. You do not report any allergies to medications. Is this correct? So this is a structured question so that the patient can say yes, no, or oh, no, it wasn't on the 3rd. It was the 4th of June, for example, because things can vary, can change. So it's the other thing. If you work in telemedicine, you go like this: copy, paste into the conversation with the physician. So this will abbreviate a lot of the back and forth. The second you get yes, that means the rest of all the information in this summary is actually going to be valid because it's the same variables. Again, you use
But
your...
there's one problem with automating, this part, and that's a consistent problem across any field of medicine, which is that if you create a structure that is too reliant on specific guardrails, you can misdiagnose because you kind of trick yourself into thinking something is simpler or more complex than it actually is. One of the more complex aspects of even triage or any kind of pain medicine that I've seen so far is that it's so ridiculously nuanced that it's very difficult to pin down very specific things. I've seen patients with such gigantic history of things going on with them that if you try to break that stuff down in a handful of questions like this, you're going to run into a lot of issues. And so if you're working with younger patients that have very little history, this works most of the time. If you're working with 60, 70-year-olds, which have literal tomes of stuff going on, it
Yeah.
gets difficult. So I'm wondering, how do you handle this in your version?
So you have to understand the natural sequence of consultation is not all in one shot. So this narrowed down process is so what's going to happen in a case like you mentioned with, let's say, like 6 different presentations. So is it dizziness because of the pain medications? It doesn't really matter as far as the documentation is concerned from this part. And what you have to see
Mhm.
is the AI is not able to, there's always a risk mitigation at the end. Even physicians, they make mistakes. So what is important here is that this is going to go from a moment where the physician does 100% of the job and then does it poorly to a higher complex case. The physician has higher degree of difficulty. It requires him more time and it requires him sometimes things that he's not even capable of comprehending.